Hi, I'm Joey McLaughlin with the Illinois Department of Public Health, and here are this week's headlines in health. Illinois health officials are exploring multi-state collaborations to coordinate public health guidelines apart from the CDC, with IDPH leaders in talks with other states, insurers, and pharmacies to ensure access to vaccines. The move follows the ouster of the CDC director and mass resignations there, which raised concerns about the credibility of federal recommendations. At the same time, some states are pushing back against Health Secretary Robert F. Kennedy Jr.'s vaccine restrictions, forming regional alliances and adopting their own immunization policies. Florida plans to roll back school vaccine mandates, and that would take about 90 days to implement and initially affect only a handful of vaccines, including chickenpox and hepatitis B. Lawmakers could later expand the changes to cover diseases like measles and polio, a move critics warn would put children and schools at greater risk during a year of rising outbreaks. Health experts say vaccines remain one of the safest and most effective ways to prevent serious illness and save lives. Urbanization and climate change are driving increased mosquito-borne disease risks in cities around the country and prompting investments and advanced surveillance in public health interventions. In Brownsville, Texas, health officials are leading the fight against mosquito-borne diseases with an intensive surveillance program to detect threats like dengue and Zika before they spread. Experts warn that while Brownsville is ahead of the curve, most U.S. cities are not investing enough in prevention, leaving the country at risk as cases of vector-borne diseases continue to be on the rise. The World Health Organization reports that more than 1 billion people worldwide are living with mental health conditions, with anxiety and depression leading the way, costing the global economy $1 trillion annually. Despite some progress, most countries spend just 2% of their health budgets on mental health, leaving huge gaps in access to care, especially in low-income nations. The WHO is urging governments to scale up investments, expand community-based services, and treat mental health as a basic right. And finally today, a new global study finds that nearly half of people living with diabetes don't know they have it, with younger adults especially unlikely to be diagnosed. Researchers say early detection is critical to prevent serious complications like heart disease and kidney failure, also vision loss. But only about 40% of patients worldwide are achieving good blood sugar control even after treatment. Experts urge routine screenings, particularly those with high risk factors or a family history of the disease. And that's this week's Headlines in Health. With the Illinois Department of Public Health, I'm Joey McLaughlin.